Hello guys, welcome to Biology Made Easy. My name is Miss Natasha and I'm going to take you through today's topic. So in today's session, we are going to look at teeth. So basically, we're going to look at the structure of teeth, the different types of teeth, and we are also going to look at how tooth decay and gum disease occur. And then lastly, we are going to look at how we can take care of our teeth properly. So without wasting any time, let's jump right into it. Teeth are used during ingestion and digestion. So during ingestion, they are used to bite off pieces of food, and during digestion, they are used to chew some food pieces, breaking them down into smaller pieces. So in this diagram, we can see the structure of an incisor tooth. So this is the crown and this is the root. So the crown is part of the tooth which is visible, or part of the tooth which we can see, and the root is part of the tooth which is embedded in the gum. So this is the structure of an incisor tooth, and the white layer or the outside layer is called the enamel, and under the enamel we can see another layer that is called the dentine. So the dentine looks like bone, but it is not as hard as the enamel. And under the dentine we can see the pulp cavity, and the pulp cavity contains nerves and blood vessels. So the blood vessels bring oxygen and nutrients to the tooth. So this is the gum, and these are fibers which attach the tooth to the jawbone. The root is part of the tooth which is embedded in the gum, and the crown is part of the tooth which can be seen. And the enamel is a hard substance. It is the first layer which protects the tooth. The dentine is the layer that is found underneath the enamel, which looks like bone. It is not as hard as enamel. And the pulp is found in the middle. It contains some nerves and blood vessels. It supplies the tooth with food and oxygen. Different types of teeth are found in the mouth. These are the incisors, canines, premolars, and molars. So the incisors are found right in front of the mouth. So there are 4 incisors on the upper jaw and there are 4 incisors on the lower jaw. So the incisors are sharp and chisel shaped, and they are used for biting off food pieces. And then the canines are more pointed. They are found on either side of the incisors. So there are 2 canines on the upper jaw and there are 2 canines on the lower jaw. So the canines are used to tear off food pieces. And then the premolars and the molars are the large teeth towards the back of the mouth, which are used to chew food. So basically, the premolars and the molars break down large food pieces into smaller food pieces. In this diagram, we can see the human skull. So we can clearly see the upper jaw and the lower jaw, and these are the different types of teeth. So these are the incisors. There are 4 incisors on the upper jaw and 4 incisors on the lower jaw. And next to the incisors are the canines. So there are 2 canines on the upper jaw and there are 2 canines on the lower jaw. And these are the premolars and these are the molars. And again, we can see the different types of human teeth. So these are the incisors. They are chisel shaped and they are used for biting off food pieces. And these are the canines. They are sharper and they are used to tear off food pieces. These are the premolars. They have wide surfaces for grinding food, and these are the molars, and like the premolars, they are used for grinding food. The teeth right at the back of the mouth are also known as wisdom teeth. They are called wisdom teeth because they do not grow until a person is much older. So right after birth, a person does not have any teeth in their mouth. But by the age of 24 to 30 weeks, about 20 teeth are present, and these are called milk teeth. So the milk teeth later fall off and new ones grow to replace the ones that would have fallen out. So in total, there are 32 permanent teeth present in an adult human being. Tooth decay and gum disease are very common problems. So both of these diseases are caused by bacteria. So there are a lot of bacteria that live inside the mouth, but most of these bacteria are harmless. So some of these bacteria, together with substances from saliva, form a sticky film over the teeth, especially next to the gums and in between the teeth. So this sticky film is known as plaque. So plaque is soft and easy to remove at first, but if it is left, it hardens to form tartar, which cannot be removed by brushing. So if the plaque is not removed, the bacteria may infect the gums. So the gums swell and they become inflamed, and they may bleed when you brush your teeth. So that's gum disease. So this is usually painless at first, but if the bacteria are allowed to spread, they may work around the root of the tooth, and eventually the tooth would have to be removed. This diagram illustrates how gum disease develops. So plaque builds up around the edges of the teeth and gums, and if the plaque is not removed, the bacteria may work down around the roots of the tooth. The tooth is loosened and may fall off, or it may have to be removed. So this is how gum disease develops. If sugar is left on the teeth, the bacteria in the plaque will feed on the sugar. So the bacteria uses the sugar during respiration, and during this process, it changes the sugar into acid. So the acid gradually dissolves the enamel, which is the outer covering of the tooth, and it works its way into the dentine. And the dentine dissolves easily, and if the dentine dissolves away, the tooth becomes painful and it might need to be removed. The tooth becomes painful because the pulp would be exposed, and the pulp contains the nerves and the blood vessels. So if the nerves are exposed, the tooth becomes painful. So this diagram illustrates how tooth decay occurs. So particles of sugary foods get trapped in cracks in the teeth, and the bacteria feeding on the sugar form acids which dissolve a hole in the enamel and dentine. There are nerves in the pulp cavity, so the tooth becomes very painful if the infection gets this far. The infection can spread rapidly through the pulp cavity and may form an abscess at the root of the tooth. So eventually, if this happens, the tooth would have to be removed. We can now see that it is very important for us to take care of our teeth properly. So there are several things that you can do to keep your teeth and gums healthy and free from pain. So first, you must not eat a lot of sugary food stuff, such as sweets. And after eating sugary foods, you must brush your teeth. You must also use fluoride toothpaste regularly, and water also contains fluoride, so drinking water also helps. So fluoride makes your teeth more resistant to decay. You must also brush your teeth regularly, at least 2 times a day, and you must also get regular dental checkups. Getting regular dental checkups will ensure that any gum disease or tooth decay is seen and stopped before the situation gets worse. It is very important for you to replace your toothbrush regularly. So a toothbrush should be replaced after every 3 months. So we have come to the end of our session. Thank you guys for staying tuned until the end.